it's not a question of moving just a bone of the skull. What I need to do is restore cranial motion in both left and right torsion. When I do this, then I will have equal muscle function on both sides. So I'm going to start this. I'm going to release this, and I won't bother to tell you what I'm doing because you need some training before you do this. If I take the occiput and I take the sphenoid here and I turn them in opposite directions, it's moving, still moving, still moving, still moving, still moving. That's the end of it. Now, if I try to go the other way, that's brick wall. I can't move anything there. So what I have to do here is I have to go in and I have to free up the joint back in here before we get started. And you're just moving pretty good there. So between each cranial bone, or shall we say at each junction there of suture, we have multiple layers of tissue, arteries, nerves, veins. So the bones are not jammed together. So what I find up here is whatever distortion you have here is going to be a distortion in the rest of the body. And I can't get it out by working below the head. So I had to come up here and get motion back in here, and then I don't even have to treat the pattern down below. I call this technique cranio-structural integration. Structural integration is another name for rawfing, because I was working on a raw for 1992 out in Santa Fe, and to make a long story short, I decided to call the work, since I'm doing soft tissue, I'm stretching the soft tissue, and that soft tissue release is what allows the cranium to change. If you just sit here and try to hold 5 grams of force or something like that, forget it, you're wasting your time. But if you go up there and you raw the cranium, you actually literally change the holding elements that make up the neck and head up there, or the top of the head, then you'll make permanent changes to everything below. I release the cranial torsional ranges of motion. So what we'll see now is what it does globally to the body. So when I come back down and I check the leg length, they're generally about even. When I check the tension in the leg on the right, we have plenty of movement. And because of that, bring the leg up in the air, hold it up. I can really lean on this now, and it doesn't weaken. And we'll check the posterior shoulder muscles here, but hold this up, and now I can really push on that, and nothing happens. Okay, turn over on your back. So remembering a minute ago, we found that the hip and shoulder flexors on the right side were strong. They were basically inhibited on the left. So if we go back and we check these now, hold this up. This one locks in place, and I'm really putting a lot of force there. She isn't showing it, but I'm putting a lot of force there. Bring the leg up down here, straighten the leg, hold tight, come down just a tiny bit, hold tight. So I would really have to work to make that go down. If we go back up over here to hold, to what's happening with jaw function and eye functioning, hold, open your mouth as wide as you can, hold. You should observe that she has a wider opening now, open again, but it doesn't affect the arm. Okay, shift jaw to the left. This was strong last time, but shift jaw to the right. This one wasn't. Jut your jaw forward. This was strong last time, retract, but this was weak last time. Look to your left. This was strong last time. Look to your right, but this was weak last time. It doesn't care now. If we cover up one eye now, look to the left, strong. Look to the right, strong. Top of your head, strong. Look toward your feet, strong. Look straight ahead, strong. Look to the left again, strong. Right, top of your head, toward your feet, straight ahead. Okay. This was a torsion pattern that we took out. Now, she has many more patterns. So, well, let me just show you one other one here. The neck restriction that we had before. If we turn the head to the left, this is about where we were before, but look what happened to the right. So we've greatly increased the range of motion to the right. In fact, she has better range of motion to the right now than she does to the left. But we haven't done anything for the fact that I can't push the shoulder down or the rib cage. That way is fine, just don't bring it back this way. Pelvis we changed, hold tight. But if we check the psoas muscle on this left side, or even the shoulder here, hold, we'll find that this doesn't work. If I bring leg up, turn leg out, hold tight, this doesn't work. Fine over here on the right side, hold tight, this is psoas. But if we go back to the tensa fasciae lata, tensa fasciae lata on the left is fine, hold tight. On the right doesn't work, hold. And if we check so we have the anterior part of the body is still in trouble on the left side, hold. So if I therapy localize to the region, anywhere I touch down here is a problem, down across the groin. This side over here on the right side, hold tight, is fine. But the whole posterior part of the right side is in trouble. So starting with the traps up here, if I touch the region, it weakens the arm, coming all the way down the back. So there's a major problem in here, and that's a lateral strain. But there are many, many other patterns in here. So what I actually corrected was about 2 techniques out of about 30-something that I have to go through in order to clear the body. And once as I clear these patterns out, the next time the patient comes in, I recheck them, and the patterns are still holding. And then I generally bring them in, after I finish all the work, I generally bring them in at the end of about a month and just double check to make sure they're all still holding. So most of these patterns hold for a long time. Now, obviously, any postural movement then is going to make a change to the cranium. So over a period of time, if the person gets into if they increase or decrease the spinal curvatures, then it's going to have an effect on the cranium up here and so on. So they may get into different patterns as we go along. But the underlying chronic patterns we will have changed. And it's the chronic cranial patterns that are determining the chronic postural compensation patterns. So the patterns that I've been working on here with Jerry are common to the population. Almost everyone has them. And these are underlying patterns, so I take these out. I generally don't do any chiropractic manipulation until I finish my cranial series and until all muscles are strong. So in other words, I am able to balance the cranium out by doing balance all the musculoskeletal system out by doing cranial techniques. And once those are out, then I go back and deal with foot problems or spinal problems, adjust whatever needs to be adjusted, and so and so. And another thing that we need to look at is there are patterns habitual patterns that people have, neurological patterns. If you go back and look at the work, the demonstration by Dr. Flo Barber, Hancock, she's presented a lot of the stuff that she's developed and she did her PhD work in. And I find it highly effective. And the fact is, when I get rid of everything that I can get rid of, I generally send my patients to her. So it's highly effective work. Go back and look at those videos that are also sponsored by Oak Works, and it should be very educational for you.